So, good morning, everyone. My name is Christine Butterworth with Rand, and I'm here with my colleagues Dan Crespin, Mekta Shifra, and members of the New Hampshire Insurance Department. Thanks to all of you for taking the time to be here today. Before we get started, I'll pass the baton to Michelle Heaton, the Director of Life and Health within NHID, for a few comments. Michelle?
Thanks. You were cutting out a little. I don't know if it was just me, but I see some nodding. So I think some other people in my head might have been experiencing the same thing. But
Okay.
hello, everyone. Good morning. We're happy here to be partnering with RAND. As many of you may know, there has been recent legislation with respect to reimbursement for ground ambulance services. And as part of that legislation, the insurance department has been tasked with working with RAND to undertake a new cost study to determine an appropriate rate for ground ambulance reimbursement. And so this is part of that cost study is we need the data in order to make those rates. So we have partnered with RAND, who has a great background in this type of work. And so this webinar today is they're going to go through some of that data request, and I guess I'll turn it back over.
Great. Thank you, Michelle. I would politely request that everyone please put yourselves on mute so that the sound is not coming over. So if everyone could please kindly place yourselves on mute and we will get started. How's my sound now? Good?
Seems good.
Good.
Seems good. Okay. So before we dive in, I just wanted to remind everyone why we are here today. Michelle introduced Senate Bill 245, which mandated this data collection process in order to develop updated payment rates for ground ambulance services. The rates that come out of the study will determine how much your organization gets paid for ambulance transports reimbursed by commercial health plans starting in January 2028. This is your chance to make sure those rates actually reflect what it costs you to provide those services. So, this data collection is hugely important, and we thank you all again for taking the time to be here today. So, now I'm going to walk through the data collection tools section by section, focusing on key things for each tab. I'm going to show you what information we're asking for, why we're asking for it, and a few examples, particularly for organizations that may share services such as fire departments. You can use the chat section to ask questions as we go along, and we will get to as many questions as we can today. If you'd like to follow along in the data collection tool, you can download it from the NHID website, and we'll post that link into the chat now. All right, so let's get started. I am going to share my screen. All right, so the first tab is a set of instructions that we are going to skip today because we are going to discuss details of the other tabs today. So let's start with section 1. This is the easy part. We're asking for some basic information to identify your organization. We need to know who you are and how you're set up so we can compare your data to similar organizations. Questions 1 and 2 define your data collection period, and this can be any 12-month period that ends at some point in 2025. This means calendar year 2025 or a data collection period that starts at some point in 2024 and ends in 2025. The next section is used to identify your organization. Question 3 asks you to report your license number, which is the 4-digit number required to provide EMS services in New Hampshire. You receive this number from the Department of Safety. We realize that some organizations are subsidiaries of larger parent organizations that operate multiple NPIs or national provider identifiers, which are used to bill insurance companies. We ask you to report this information in question 13. NPIs under the same parent company will need to fill out a separate workbook for each NPI. Questions 17 through 23 ask whether you share operational costs with services other than your ground ambulance operation. We know many of you are co-located with fire departments, and you may share staff, you may share station space, dispatch services, or other costs. Don't skip this. If you check no when you actually share costs, your costs may look much higher than for organizations not sharing costs with another service line. Okay, so section 2 is all about your service volume and your service mix. For this section, we're interested in how many responses, transports, and paid transports you had during your 12-month reporting period. A couple of key definitions to review. Response is when any vehicle, such as a fire truck, ambulance, gets dispatched to a call. A ground ambulance response is when a ground ambulance is sent to the scene. If you sent a fire truck but no ambulance, that does not count as a ground ambulance response. A ground ambulance transport is when you actually picked up a patient and moved them in the ambulance. A paid ground ambulance transport is one where the patient or insurer actually paid you something during your reporting year. For the paid transports, don't include transports you billed for but haven't collected on yet. We realize that there is a time disconnect between services that are provided in your reporting year versus services you may have actually been able to collect money for. This tab contains some data validation checks that will pop up if you have tried to answer something that doesn't make sense. So, for example, in this service mix section, the number of ground ambulance responses should be equal to or less than the number of total responses. If you enter a higher number, the warning will pop up like you see here. If your ambulance is dispatched to a call, but the crew does nothing, that still counts as a ground ambulance response, but it may be classified as a no transport, no treatment. Alternatively, if you delivered care at the scene but did not transport the patient, this response can be reported in question 6 as a treat, no transport. We are also collecting information about your organization's service mix, which is an important driver of costs. These are the rows collecting the number of transports by HCPCS that occurred during your data collection period. If the transport date occurred during your data collection period, then report it here, even if payment occurred afterwards. You should report unbilled transports in the appropriate row if you know the service type. If you don't know the service type for an unbilled transport, then report it in question 17. I just wanted to remind everybody to make sure you're on mute until the Q&A section, and then you're welcome to come off mute and ask a question. You also can put questions into the chat, and we'll get to as many as possible this morning. At the bottom of this section are some rows with blue shading that look like this. These rows with blue shading are meant solely to be checks on the data that you entered. So for example, on this page, in the service volume section, the tool will add up all your HCPCS code entries and compare them against the total transport number. If they don't match, it'll tell you to check your data. And it's just a warning light. Go back and make sure you reported all your transports correctly. One more note to help with the service volume section is that if you do work with a billing company, we strongly encourage you to work with them to assist you in pulling information on your transport volume by HCPCS code and the associated revenue. All right. So with that, I am going to pass the baton to Dan, who will go over the labor cost section.
Thanks, Christine. Before we do that, there was one question in the chat. So Laurel asked, what about cost sharing with a municipality? So going back to the shared services. So I think this question is probably getting at you're going to enter your data differently if you share with a municipality versus, it's shared just within an organization.
No, and we will get to that case where you may have some costs that are shared with your local government. I think some common examples are IT costs or HR. Those can all be reported on the non-labor costs tab section, and we'll go over that in a moment.
Okay, so hopefully that cleared up that. So I'm going to talk about the next section, which is on labor costs. And so this tab is where we ask you to report on your staff and the compensation you paid the staff who do ground ambulance work. And we've broken this up into 6 categories of staff. So we have basic life support providers, which includes EMRs, EMTs, advanced EMTs. The next category is for advanced life support staff, which would include paramedics. Then we have non-medical response staff. So this would include staff such as drivers. Another category is medical direction. So this would be physicians or other medical directors. Then we have administrative and facility staff. And then lastly, we have parent organization labor. And this will only apply if your organization is part of a larger system. And for each category, we'll ask you to report on the total number of staff, how many staff are volunteers, the total hours they work during the year, and that includes ground ambulance or other activities. And then we'll separately ask you for total hours related specifically to ground ambulance services. And then lastly, we ask for total compensation. And again, this will include ground ambulance and other activities. So we want to talk about hours related to ground ambulance services in a little bit more detail. So this is critical for fire departments or any other organization with shared services. For staff that work in your ground ambulance operation, you report their total hours and total compensation, while also indicating the number of their hours that are associated with ground ambulance. If your operation is 100% ground ambulance services, then you'll just repeat the total hours from the row above. So now let's walk through an example. So let's say you're the fire chief with a small fire department. You have 8 full-time firefighter EMTs, and you paid these folks about $800,000 for the year. But these 8 staff also respond to structure fires, vehicle accidents, hazmat calls, and other activities outside of their ground ambulance responsibilities. So here we're going to go through an example of how you could allocate total hours to ground ambulance. So one allocation factor you could use, for example, is the percentage of total responses that were for ground ambulance. So for example, if your organization did 200 total responses, including ground ambulance, fire trucks, or any other activities, and of those 200, 120 were for ground ambulance responses, then you'd simply just divide 120 by 200 to find your percentage of responses related to ground ambulance services, which in this case is 60%. Okay, so now we're going to show you how you would fill this out. So staff, you're still just going to report the number of staff, which is 8 in this example. If any of them were volunteer staff, you'd also fill that out. For simplicity here, we'll just assume there were no volunteers. In the next row, you'll fill out total hours. So for example, if they were all full-time, working 40 hours per week on ground ambulance and other activities, this would be the 8 staff times 40 hours per week times 52 weeks per year, which is about 16,600 hours. And then the next row is where you would allocate to just ground ambulance services. So for this example, you could just apply the 60%, which is the percentage of response related to ground ambulance, to the hours in the row above. And this would be a little under 10,000 hours related to ground ambulance services. And then in the last row, we'll report total compensation. And again, this is total compensation for ground ambulance and other activities. And you want to include everything here that is paid to your employees, including salary and wages, any paid time off programs, insurance premiums, retirement, stipends for volunteers, and any benefits. And you want to make sure you're including all those categories, including benefits. Otherwise, your cost may look artificially low. So thanks. I think we can go to the next slide. So now we're just going to go over a couple other common questions related to this tab. So one question we received is, how should volunteer staff and stipends be reported? If you have volunteer staff, you'll want to report the number of volunteers, then report any stipends or per call payments you give them. So for example, if you pay volunteers $50 per call and they did 500 calls, that would be $25,000 that would go in the total compensation row. Another question we commonly receive is, how should parent organization labor be reported? So some organizations may be operated by a larger parent organization, and it's important to report these costs so that the costs for the individual organization that is reporting data do not look artificially low. So these costs typically reflect costs incurred at the parent organization level. So for example, salary for corporate staff that is then allocated to your organization. And you can report these labor costs incurred at the level of the parent organization on this tab that's in question 26, or you can enter it into the next tab that we'll talk about in the overhead section. But it's important not to double count and report it twice. And then in this tab, as we have in several of the tabs, there's a few built-in checks, and these are in the blue shaded rows at the bottom. So the tool will do things. It will calculate your average hours per staff person per year, your average compensation per person, excluding volunteers. And this is here to see if something looks wrong. So like, for example, if you have average hours per staff in a year that's way higher than about 2,000, which would be full-time work, that's a signal just to go back and double check that everything you've entered is correct. Then just one final note for this tab, and I think we've mentioned this a couple of times already, but it's important just not to double count. So for example, if you're reporting someone's full compensation on the labor tab, you wouldn't also want to include them as a vendor in the non-labor tab. So I think we
Thanks,
probably
Dan.
have some questions in the chat.
Yeah, Dan, it looks like there is two related questions about part-time and sort of per diem staff and how to count those folks. In this tab, it's structured so that you should report the full number of people you have on staff during the year and their hours. The hours per person will come out to show that they only work, part-time or less. And then there's one other question in here, Dan, about how to handle staff who have multiple roles. Do you want to take that one?
I think, did we put that in the instructions at the top?
Yes, it is in the instructions at the top.
Yeah. So on this one, I think, Christine, I think we decided that you would put them to the category where their biggest responsibility is. Is that correct? I want to make sure I'm recalling that correctly.
That is one option. We have generally preferred that folks report medical response staff as the preference. But if you have administrative staff, such as the example in the chat, such as the chief officer, who is primarily doing administrative duties and only occasionally working as an EMT, we would recommend you put them under the category where they serve the bulk of their time. All right. So with that, we are going to move on to the non-labor costs tab. This is the biggest section where you report all of the non-labor costs of running your ambulance operation. This includes vehicles, both ground ambulance vehicles and non-ground ambulance vehicles, facilities, supplies, equipment, any overhead, and vendor costs. The first question asks for your organization's reporting accounting method. Cash basis is when you report costs when you actually paid them. An accrual basis is when you record costs when they're incurred and use depreciation to smooth out the cost of big purchases. If you use accrual accounting, you can report depreciation for big purchases, which is important because if you bought an ambulance a couple of years ago, you can report the annual depreciation cost in the template. Throughout this sheet, we wanted to highlight that there's a column for reporting allocation factors. This is key for the organizations that have shared service lines like fire departments. Just like with the labor costs, many of these non-labor costs will be shared between the ambulance and other operations. The allocation cells are grayed out in cases where we expect the full cost to be 100% related to ground ambulance services. So for example, the ground ambulance vehicles section, we expect that to be 100% related to your ambulance services, and there's no need to report an allocation factor there. So let's take a look through a concrete example for facility costs. If your fire department operates one station that houses 3 fire trucks and 2 ambulances, you would report the total cost for each row in the response column. So for example, in this example, the building may have an annual mortgage, depreciation, or leasing cost of about $30,000. There may be $10,000 in facilities maintenance costs and $10,000 in taxes and insurance. So you report those total costs in column D. Then you need to report an allocation factor in column E. One reasonable approach is to use the square footage of the building. So, for example, if the ambulance bays and ambulance storage take up about 40% of the station's square footage, you could report 40% as your allocation factor. Another reasonable approach is to use the response ratio. So, if 60% of your total responses are ground ambulance responses, you could report 60% as your allocation factor here. Now let's talk about the vendors section for a moment. Many organizations will contract out with other entities to provide some services like janitorial or maintenance services. If you contract with a vendor, for example, to clean the station or maintain equipment, and that vendor does work that supports both fire and ambulance operations, you would report the full cost of the vendor and use a similar allocation factor to what we just discussed. Another common example is an external dispatch center, and you would report whatever fees you pay to the dispatch center in the vendor section as well. I also wanted to go back to that example of the ambulance services operated by a municipality. If the municipal system or the city provides some portion of support, like IT support, accounting services, HR, anything that benefits your ambulance operation, you should report a portion of those costs in the vendors section and use a reasonable allocation method like any of the methods that we've discussed so far. Another reasonable allocation method for this scenario of the municipal system could be to use the ratio of the ambulance budget to the total city budget, could be another reasonable allocation factor here. As with the other tabs, this tab also contains some section checks in light blue shading throughout each section, as well as some checks at the bottom of the tab to check all of the information reported in that sheet. If something looks off, please check your reported data. It's just meant to help you ensure that the data you've reported is accurate. A couple of common mistakes to avoid on the non-labor costs. As Dan noted with the labor costs, don't report the same cost twice. If you report a vendor fee in the vendor section, don't also report it in the overhead. And similar with labor. If, for example, you report some labor costs in the vendor section, don't also report them in the labor tab or vice versa. Another reminder is to don't forget to include costs even if they're small. Things like training materials, uniforms, cleaning supplies, these all can add up. One final note here is don't report costs from before your data collection period. All right, so let's take a look at the chat here.
Yeah, so we have one question about this is going back to shared services, asking if they're able to identify specific expenses for ambulance and non-ambulance, can they not use an allocation factor? I guess just report ground ambulance and an allocation factor of 100%.
Yes. Yes. So Karen, right, you could okay, and then for Laurel, for a municipal fire department, isn't the town the parent organization? That is one way you could think about that. The parent organization, often we think of an organization operating multiple NPIs. And if your parent organization operates multiple ground ambulance NPIs, those parent organization questions allow you to report some portion of your centralized corporate costs that relate to the specific NPI that's reporting. In the case of the municipality, we don't necessarily, this isn't the intention of the parent organization questions. So I think, Laurel, for your question on the municipal fire department, report any cost that your city incurs on the ambulance organization's behalf, either in the overhead or vendor section as appropriate would be just fine. And you don't need to fill out all of these parent organization questions. Okay, so if you operate your own dispatch center, this is a great question. If you operate the dispatch center, that is part of your costs of running your organization, and please report that in the labor tab. Dispatch can be included in the non-medical response set of rows. If other organizations are paying you fees for you using your dispatch center, report that on the revenue tab, which we are about to turn to now. Okay, the community paramedicine program, how to treat those calls. Let's circle back to that after the revenue section, and we'll go back and take a look at the volume section. Okay, so Dan, over to you.
Okay, thanks. Okay, so this is the last section of the tool, section 5 for revenue. And this is where you'll report all the money coming in for your ground ambulance services. And they were collecting this data because it helps us understand how ambulance services are funded in New Hampshire, since many may be funded in part by tax revenue, payer revenue, or other sources. So the first set of questions is going to ask you to report revenue separately by source. Your organization may not have revenue from all these sources, so in those cases, just report 0. For patient cost sharing amounts, it is not required to separately report this information if your billing systems do not easily track it. And one related question we've had about this is what to do if insurers mail checks directly to patients. So for example, if the patient deposits it. So if the patient never paid you, then you don't need to report it since you never received it as revenue. So it's not on you to track that. If the patient did pay you, then you can report it however is easiest for you, either under the payer category or under patient self-pay. Again, main thing is here is just to report each source once. Then the tool asks for revenue from a variety of other sources. Again, if your organization doesn't have any of these sources, just report 0. And if any of the revenue is partially related to ambulance services, so maybe you sell something that's 80% ambulance related and 20% fire related, then just report the total revenue in column D and the allocation factor in column E. You'll also notice that for some of these revenue categories, there's no allocation factor, and that's because we're assuming it to be 100% ambulance related. So for example, if Medicare pays you for an ambulance transport, we're assuming that's 100% ambulance revenue. We did want to flag local tax revenue. So if your municipality funds your ambulance operation with tax dollars, you want to report that. And this is often the biggest revenue source for municipal fire departments. So for as an example, if your municipality provides your fire department with $2 million annual budget and uses that budget for both fire and ambulance operation, you need to estimate what portion is for ambulance services. And you can use several of the allocation factors that we've already discussed today. So for example, in the labor example, we use the share of your responses that were for the ground ambulance. And so anything of that example is 60%. So in this example, if you had $2 million in total budget and you had 60% related to ground ambulance, it'd be 2 million times 60% or $1.2 million. Finally, you'll notice at the bottom of the section, there's an extra data check. So this tool compares your total cost to your total revenue and tells you the percentage. And these are mostly just here for sanity checks. So if it's close to 100%, you're capturing most costs and revenues appropriately, and that's a good sign. Say, for example, if costs were less than 25% of revenue, then you might be missing some costs. And then on the other hand, if costs are, say, more than 200% of revenue, you might be missing some revenue sources or have some reporting errors. And some common issues we've seen include not reporting tax revenue, not reporting donations or grants, or reporting costs from outside your data collection period. There's also a second version of this check that adjusts for allocation factors. These, again, are for organizations with shared services. So if we report allocation factors, the second check accounts for these. And again, this is all just meant to be a sanity check. So if anything looks weird, you'll just want to go back and review your reported data. So I think that's the end of our walkthrough of the data collection instrument, but I think maybe we can pause here if there's questions for this tab, and then we'll go on to the Q&A and talk a little bit about how you can get help if you need it.
All right. Um, okay, do we report revenues as gross revenue or net? Um, it should be gross on this tab. If
Yeah.
we, yeah, because we will have all of your cost information and then, would be able to calculate that. But let us know, Karen, if you're thinking about something else in specific. All right, there's another question on revenue, Dan, that asks, when reporting revenues, we only are able to break them down by Medicare, Medicaid, and other. So how should we report our other?
That's a good question. So I think that's something. So we did not put. Trying to go through here. So we have an other revenue in question 22. So I think if you can't identify, that portion of revenue, I think that can just go in there and then just add a description in question 23. So that'll help us understand what the kind of the breakdown of your revenue sources are.
That's right. Um, yeah, and if you have any ability to break down how much revenue accrues to the commercial payers, that is wonderful information, but we understand that not everyone is able to have as fine-grained reporting as this tool allows for. We have another question about if you have an EMS service that's partially tax and partially billing funded, we actually expect that that is the most common scenario, Michael. And the way to handle that here is to report the revenue that you receive from the billing um, up at the top of the revenue tab. So in this section, this is revenue by payer. And then in the bottom section of this tab, you can report the local tax revenue in question 15.
Okay. I'm not seeing any other questions at the moment. So we'll open up the
Yes,
Q&A in just a minute, but just a couple other things just to share some information. So in case people need to leave early. So remember, the completed data collection tools are due on August 28th. The email address for the help desk, as well as the NHID website, can be found in the calendar invitation for this webinar. And then we've also posted that in the chat as well if you're looking for it. So your organization should have received the link for the secure upload folder, as well as an email of a document that does a step-by-step walkthrough of the data collection upload process, just how to upload the actual tool. Again, we want to thank everyone again for everyone's time and their participation in this. We know you're very busy. We're looking to get as much data as we can so we can have accurate rates, as this data is
that's
going
right.
to reflect the official rates that's going to be paid to you. So it's really important that our information is accurate. We view this as really important work, and we really appreciate you taking it all seriously and taking the time to submit data. So I think with that, we can open it up to Q&A. You're welcome, I think, to come off mute and ask, or ask in the chat.
Thanks, Dan. Let's go back to this community paramedicine program. The question is, do you want us to capture those calls under the treat non-transport, or is that outside of the grand ambulance study? Um, those we would absolutely suggest that you capture those calls. Those, if an ambulance is sent to the scene, that would be still counted as a ground ambulance response. If your community paramedicine program is structured so that you are not actually um, going to the scene in an ambulance, but you are billing for that service, I think in that case, it does not get reported in the top section up here because it's not actually a ground ambulance response or a ground ambulance transport in that case. However, you could put any community paramedicine activities in the other transports section on this volume tab. Now, the flip side of the utilization is the revenue that your organization might receive. If you are receiving payment from an insurance company and you are able to bill for that community paramedicine visit, I'm using the term visit loosely, but um, for that service, if you are billing for that service, you can report the revenue under the payer that is paying for it. Alternately, if you're not billing, but there's another separate payment structure, I would report it in the revenue. I'm gonna forgive the screen flipping here, but let's go to the other revenue. I would report it in the other contract revenue. If you're not billing for it, but it's something that you receive, let's say on a monthly basis, report it in the other revenue. Okay. The recording today will be posted on NHID's website. The slide deck is actually just screenshots of the tool that we use because the Excel wasn't displaying very well. The two examples that we have, we'll add to the FAQ and post that. But otherwise, it's much better to look at the tool itself because you'll be able to see the instructions with clear detail. Okay, what's the difference between the local tax revenue and the local tax revenue municipal contract? This is two separate rows to allow for flexibility if organizations capture this local tax revenue differently. Local tax revenue would be what people normally think about where you might get a mill levy or something like that that goes directly to your organization. Local tax revenue through a municipal contract is if you have a legal setup where you are contracted with your local municipality for some specific services. The main thing is just to report your revenue from local governments in the tool in one of these two roles. Okay, how to report lift assists handled by an ambulance for which we do not transport. I think that is another common example of a ground ambulance response. If an ambulance is dispatched, that would then get reported in the treat no transport category. I'm sorry, one more comment on the question about community paramedicine. The last question in that section for Scott was, are insurance companies looking at reimbursement rates for the mobile integrated health programs? That is not on our scope at this juncture, but I defer to the NHID folks on whether that might be a policy initiative that they might review in the future. But at this time, I don't think it is it's in scope.
That's correct.
Okay, great. All right, so we still have 20 more minutes, and Dan and I are happy to stay on for as long as folks have questions. We're happy to answer them. As I noted, the recording will get posted to the NHID website. We will add the couple of examples that we went over today to the FAQ document. But otherwise, the full instructions, it's best to download the data collection tool off the NHID website because there's detailed instructions on each tab. One other question while we're waiting, just in case folks are thinking of some other questions that they might have. One other question that we've seen fairly frequently in the last week is, how do I access the portal and the data upload process? We have emails on file for every license number. We sent a secure upload link to each of those emails on our list. If you do not think you've received your secure upload link, please email the help desk and we are happy to ensure that the right email address receives that link. The The actual, sorry, I was looking at this new question from Fire Chief. Can we start and go back to add more? I'm not quite sure what you mean. So if you want to add another clarification there, we're happy to ask your question.
So
But the
that might be a
portal,
question about
oh, go ahead,
submitting
Dan.
submitting the tool more than once if there needs to be updates, which I believe we have the capability to do.
That's right. We do have the capability to do, but it's not necessary, I don't think. You know, the data collection templates, oh yeah, start adding information and finish later. So you're right, Dan. We would prefer that you upload a completed template. The portal is open until the end of August, so you still have another month. So should you need to update information, we do have the ability to handle a second upload, but we would prefer that you uh, upload a full finished data collection template.
So
Okay,
we
so
have.
Laurel, go ahead, Dan.
Oh, I was gonna say, we have another, yeah, another question about how to list. I mean, we had a couple questions about how to list staff members, who are working part time, may not work for a long time, may retire. And I mean, the tool asks for staff, so I would report staff number in total. We're not asking for FTEs. So I think that's fine. I mean, the main check we're gonna be looking for, in some of this data is that like the hourly wage would make sense. So I think that's fine just to report the total. Christine.
Yep, I would agree. This tool is structured to report full, the number of people and their hours. It's not structured to report FTEs. That is something that we discussed, but it wasn't clear that all organizations' accounting systems captured individuals in the FTE type of method. And as we noted, our previous webinar is also on the NHID website as well as the FAQs. We'll add these few examples to the FAQ as well as some of these questions that have been asked in the chat today, just so everyone can benefit from the question and answer that has been asked today. So thank you all for asking questions because it will surely help some other organizations who may have the same question. All right, if we're slowing down on questions, maybe Dan, we will stop at the 45-minute mark. And if folks think of other questions later, please email the help desk. Mecta has added the help desk information to the chat. And it is also listed in the FAQ as well as in the data collection template. So we are here and available to assist with any data reporting questions. And as I noted, the data collection portal will be open until August 28th. So you have another month to fill out your data collection tool. So as you're in process, if questions arise, please email us. All right, all. Last call. Last call for questions. All right. Seeing none, we will go ahead and conclude today's webinar. Thank you again so much for being here today. Please email the help desk if you have any questions that arise as you're working on completing your data collection template. I'll just plug one last reminder for the NHID website. It has all of the materials which you can download there, and we will post this recording there as soon as it's ready. Thank you, everyone, for being here today.